Okay. Well, welcome everyone. My name is Gregory Gale. I am the Director of Recruitment and Admissions for the Nova Southeastern University's College of Psychology. And I'm excited to actually bring you this presentation. So welcome to the session called Police Psychology. This will be an hour-long session. It is being recorded and will be available online. And it will be available at the departmental website, which is www.nova.edu/DRA, which is short for Department of Recruitment and Admissions /events. We encourage your questions. So if you're familiar with this technology, what I'd like you to do is you can submit your questions by going to the chat feature on your panel and submit your questions. And we'll be able to answer them at the end of the presentation. For those of you, again, familiar with the format, the PowerPoint that we're going to be using for this presentation will be located or is located in the materials section of the panel. So at your leisure, you can download the PowerPoint presentation and follow along. So I am thrilled to introduce to you our presenter. Dr. Vince Van Hasselt has been a professor at Nova Southeastern University since 1992. He is a professor. He's director of the Family Violence and Adolescent Drug. He's director of the Family Violence Clinic, as well as the Adolescent Drug Abuse Prevention and Treatment Program at the university. Much of his research involved collaborations with the FBI's crisis negotiation and behavior science units. He is the co-director of the FBI's Global Hostage Taking Research and Analysis Project. He also served part-time as a police officer in the city of Plantation, which is in South Florida, for the past 20 years. He actually co-founded the department's crisis response team. He's an instructor for Broward County's crisis intervention team that provides advanced training to police personnel dealing with the mentally ill. And he'll talk about that during his presentation. He's also the team psychologist for the hostage negotiation unit of the FBI Miami field office. He's been an instructor at the FBI National Academy in Quantico, Virginia. He currently serves as editor-in-chief for Aggression and Violence Behavior Review Journal, the Journal of Child and Adolescent Substance Abuse, and previously he served as editor of the Journal of Family Violence. Additionally, in 2014-2015, he was recognized by the university for his work, and he was given the honor of Distinguished Professor of the Year. So I am thrilled to present to you our presenter, Dr. Vince Van Hasselt. So
great. Thank you for that introduction, Greg.
You're welcome.
And welcome to those of you who are on tonight. It's a pleasure to be here. I just want to correct one thing that Greg said. I am still a police officer with the City of Plantation Police Department. I've been there since 1995, so I'm entering, I guess, close to my 24th year, still active with the department. So, excuse me, as you can see, I have a foot in both camps, psychology as well as law enforcement. My training is as a clinical psychologist, but my specialty area for the last 20 plus years has been police and first responder psychology. So what I'm going to talk about this evening, and again, we'll be open to questions afterwards, is giving you an overview of police psychology, at least in terms of what I've done and some other areas as well. It's a pretty big field, but it's a relatively new one. And I tell my students that it's an exciting field because it's one that you can't be in this line of work sitting at a desk all day, because you have to spend time out in the field doing training, doing some things that we would consider operational. The shirt I'm wearing today, and I told Greg this, is my CIT shirt that stands for Crisis Intervention Team Training that I was doing this morning, which is essentially a 40-hour program. I call it abnormal psychology for law enforcement, to teach them to deal more effectively with the mentally ill. So we'll talk more about that later in the hour, but that's one of the functions of police psychology, to do teaching and training in areas where they have some expertise. So let me start by defining police psychology, and I have a very simple definition for this. I call it applications of psychological strategies to support law enforcement functions. And I always like to distinguish it from forensic psychology, because a lot of students will be confused. They'll say, well, are you a forensic psychologist too? To which I respond, no, not at all. However, if you see textbooks on forensic psychology, you'll almost always find a chapter on police psychology, which makes it appear that it's really part of the forensic field, and to some extent, or historically, that's been the case. However, the function of a police psychologist generally is much different than a forensic psychologist. Forensic psychologists do an awful lot of evaluations, testing, but generally of offenders. And they do expert courtroom testimony, which I haven't done at all. Again, my interest is what I can do to assist law enforcement personnel in their day-to-day activities, and that includes apprehension or strategies to apprehend subjects or interview subjects, as well as to negotiate with them if you're dealing with barricaded people. We'll talk about that when we get to hostage or crisis negotiations. But beyond that, that's the extent of my work. The forensic psychologist, in a sense, takes over after that. Once somebody is apprehended, arrested, or hospitalized, even, that's when they do their psychological evaluations. I will mention one particular area of police psychology that's very important, but one that I don't do, and I'll explain why that's the case in a moment. But it does have to do with evaluations. When police psychologists do psychological assessments, it's usually for two purposes. The first is to do police screenings, or what we call screenings of new police candidates. So these are people who want to become police officers, and most departments around the country now do require that their candidates go through an extensive psychological battery, which usually consists of different personality measures plus an interview, but it's pretty extensive. It's usually a day-long process. And then those measures are scored, and the psychologist makes a decision as to the suitability of that candidate to be a police officer. So that's the first assessment experience that police officers have, at least those who are candidates, but eventually those who make it. They look back at that experience very often is not a particularly pleasant one, because it is pretty labor intensive and involved. The other point at which police psychologists are involved in assessments has to do with something called fitness for duty evaluations. And this is if an officer seems to be having a problem, which could be anything from tardiness to citizen complaints, which everybody has, but where you have a spike in those, or something seems to be going on unusual with that officer, complaints from fellow officers, again, showing up late for work, not doing well on the job, not keeping up with paperwork, whatever it may be. If a supervisor feels that an officer is having some problems that are above and beyond the usual, they may recommend that a fitness for duty evaluation be done. These are relatively rare, but they're still important, and they're still a function of the police psychologist. We divide police psychologists into two groups. The first, those doing the assessments, are the assessment specialists, and many police psychologists do that as a career. That's what they do, and it can be very rewarding, very profitable. They can get involved with different agencies. They can work, I know some police psychologists who work with half a dozen agencies doing screenings and fitness for duties both. Then the other group is more what we call operational. Operational police psychologists are those that are out there doing teaching and training of police officers. They may be attached to a hostage or crisis negotiations unit. They may help train that unit. They're out in the field, they're on call if there's a situation that arises, like a barricaded subject or barricaded suicidal person or hostage situation. That's more operational, and they're out there in the field. So I've always viewed myself very much more so as an operational police psychologist. That's just because of my interest. To do the assessment portion takes a lot of patience that I just don't have. But when I've been in private practice in the past, I've specialized in issues with first responders. If I felt that one of my clients or patients needed an assessment, I would refer them to an assessment specialist that I trusted and knew was very good and could do a comprehensive evaluation. So just to make that distinction, there are different functions, and we'll see on a few slides that are coming up a lot of different functions that police psychologists can serve, both within as well as outside of the agency. Greg, let's advance this slide if you would. Let's see what we have next. Okay, excuse me, getting over a cold. Part of the reason that police psychologists are attached to police agencies and are recruited to work within an agency or as a consultant is the fact that you name a mental health problem, and if we consider the rates, prevalence or incidence within the first responder population in general, but police officers in particular, we almost always find that they're 2 to 3 times the rate of civilians. All right, so what I mean by that is if we look at depression, 2 to 3 times the level in law enforcement than civilians. If we look at anxiety, if we look at stress-related problems, if we look at substance abuse, all right. The slide you see, of course, is marital difficulties, and this has always been a hard one to get at just because research with law enforcement has historically been difficult to do. But the best that we can determine now, given the research that's out there, is the fact that roughly 75% of law enforcement marriages end in divorce, okay? And that's compared to 50 to 55%. I think that's the most recent estimate in the civilian population. All right, so that's pretty high, 75%. Now, when I do teaching and training for police officers in law enforcement family issues and law enforcement family stress, I will joke with them and say, well, now that you're older and you're wiser, you're more experienced, and you have that one divorce behind you, what do you think that divorce rate is for second marriages? And they're pretty accurate. It's pretty much the same. All right. So it's not uncommon to have multiple divorces in law enforcement personnel. As you see, at least a third of law enforcement officers report serious marital difficulties. This last item on this slide, actually, it's an old reference, but more recent research supports this as well. When you look at police suicides, the majority of them are preceded by serious marital conflict. We did a study in-house at Nova, my doctoral students and I, looking at the prevalence of police murder suicide. So that's homicide, suicide committed by police officers within a 6-year period. And we found about 45. There's a similar study conducted over a 6-year interval before we did our study, and they found very much the same. So not only, we'll get into police suicides a little later, but it really shows the fact that, relationship problems, marital problems, and in fact, domestic violence are not unimportant problems when it comes to law enforcement. Those are big issues. Greg, let's look at the next slide. All right, I will just do this one briefly, but we know that the best predictor of child behavior problems is the availability of parental supervision, for one thing. And in the law enforcement family, often mom or dad, the police officer, is often gone for extended periods of time. Now that can go from the road patrol officer who works their shift and does their 40-hour job, but also takes on extra hours, what we call detail work, doing extra hours somewhere to provide security for payment, of course. But I always say that, well, it's extra money, but it's also extra time away from family. All right. And non-compliance in adolescence is not unusual in law enforcement families. Greg, let's look at the next one, please. All right, so here we have some of what we talked about. Nearly a third of police officers abuse alcohol, not other drugs, because you can drink, but if you come up on a random drug test positive for anything other than alcohol, which won't show up on the drug test anyway, but you get fired. All right, those are usually unacceptable. So alcohol has always been the problem. The bigger problem, of course, I believe, and many police psychologists feel the same way, is that of post-traumatic stress disorder. And in many cases, we're talking about officers who are probably self-medicating something like PTSD or something close to that. I don't know how much time we'll have to get into this, but post-traumatic stress disorder is certainly a high risk for any first responder group, and we tend to find these at relatively high levels. Best estimate in law enforcement, based on the research we have, is that it's probably affecting 25% of police officers who are diagnosed or diagnosable with post-traumatic stress and stress disorder. It's not surprising, because when we're talking about any group that's repeatedly exposed to traumas, like police officers, firefighters, crime scene investigators, the military certainly, well, you're going to have higher percentages than the civilian population, which shows levels of post-traumatic stress disorder typically at maybe somewhere around 5 to 7%. All right, so much, much lower. All right, depression, anxiety, anger management. Let me talk about anger management just for a second, because what we're often talking about there are depressed law enforcement personnel who may manifest their depression through irritability and anger. All right, not everybody who's depressed sleeps 16 to 18 hours and is listless and feels like not doing anything. You have a subgroup that manifests depression by irritability and anger, and that's not uncommon in law enforcement. All right, and you see the other problems, serious health problems, high blood pressure, coronary heart disease. I don't know if we have it in a slide coming up, but just to kind of jump ahead, maybe we don't have it. The average lifespan, as best we can tell, of a male police officer in this country is somewhere between 63 and 65 years of age. Now, the civilian population, that number's closer to 75 to 79 years of age for males. So that's a pretty big difference, all right, 63 to 65 versus upper 70s. And most of these early deaths are related to cardiovascular disease. We don't know much about females in law enforcement. Most of the data at this point really pertains to males. So anybody who might be interested in research in this area, that's really sort of an uninvestigated area at this point. We don't know really enough or a lot about female police officers and their adjustment and their stressors and the way they respond. So much more is needed there. You see the comment about suicide. Interestingly, generally there's been the feeling, well, police officers commit suicide at a higher rate, and that's what it says there. But more recent data are really suggesting, well, it may not be that much higher after all. However, as you see at the bottom there, a finding that holds pretty consistent over time is that on average, about twice as many police officers kill themselves than are killed in the line of duty, all right? But the past several years have not indicated that suicide rate in police officers is necessarily higher than civilians. But it is troubling that many more take their own life than die in the line of duty. That can change from year to year, and certainly we have had a number of police officers killed this year. I think the number is 80-something already, and the year's not up yet. So we'll have to see how the numbers fall, but that's generally been the way things have gone. Greg, the next slide. All right, I'm going to go through these very quickly. These are just examples, this and the next few slides, that you see different things that police psychologists can do or to get involved with. Let me just highlight a few things. Critical incident response, crisis interventions. If we have time, we'll talk more about critical incident debriefing, crisis intervention. Certainly employee assistance programs and counseling. And within EAP programs, you often have mental health experts, master's or doctoral level, providing services. That's been sort of a sensitive issue for a couple of reasons. One, often EAP programs are, let's call them citywide programs, and they'll deal with any person or problem coming from within a geographic area. They may not know a lot or specialize in first responders. The other problem is some of these programs are based within a police agency, which is always a problem because officers will generally avoid being seen going in or coming out of these. So where they work best is when you have them in actually a separate, physically separate location. Individual counseling, long and short-term therapy, stress management, wellness programs, all those are very important. Although, we could talk for the next hour just about the stigma and cultural issues in law enforcement that are relevant in trying to get officers engaged in treatment, counseling, or therapy when necessary, and that's not the easiest group. And, in terms of those sorts of things, and my experience has been both as a private practitioner as well as a consultant to police organizations, we're trying to encourage those who need help to get help But of course, the stigma has always been, well, if I go for help, I'll be perceived as the weak link. I don't want to be seen going. The culture is you suck things up and grin and bear it and get on with things. But as we know, that perspective has really been sort of the basis for a lot of mental health problems historically in law enforcement. So I think some agencies, or a number of agencies, are really trying to change that stigma. One of the ways that that's been done, and it's not on a wide scale yet, but I've been involved, and several others around the country have been involved in the development of peer support programs, peer support training programs, where the training is to teach peers to be, as a firefighter friend of mine once used the expression when we did this with firefighters, teaching smoke detectors in a sense, trying to teach people to become sensitive and aware of those people who may be at risk for problems and to try to catch those early, and to have peers assist in getting their peers who are having difficulties the help they need. In some cases, actually going with them to a counselor or to a therapist, or in some cases, extreme cases, helping them to be admitted to a facility that, an inpatient facility or residential facility when those are called for. That's not easy. These are new programs, but I think peer support and peer training really has a lot to offer, and I think that's kind of the mediator that makes a big difference in terms of people getting the help they need and not getting the help. If it's up to them, even if they feel they need assistance, often police officers will not come forward on their own. That's just a fact. Greg, let's see the next slide. Okay, critical incident debriefings. We'll try to get into that before we wrap up today. Some of you may be familiar with the whole area of critical incident stress management, CISM, which includes critical incident diffusings and debriefings, family support, and some other functions. We can't get into detail on this, but essentially the idea with this has always been following a critical incident. In law enforcement and first responder lingo, we call bad things that happen that are above and beyond the norm. We call those critical incidents. In psychology, we call them traumas. They're basically the same, just different terms. What the briefings focus on is getting people together after a particularly difficult trauma occurs, basically above and beyond the norm, even for law enforcement, bringing people together to talk and vent a bit and emote. There's sort of a structured approach for debriefings that we don't have time to get into. But my experience has been, and many others will say too, where you have officers come together, not just officers, but anybody involved in an event. Could be the officers, could be firefighters, it could be dispatchers. I just did one of these recently that involved all three responding to a difficult situation involving a child. And you give them the opportunity to form a group, come together, talk, discuss their experiences, and have a follow-up contact or contacts to help, beyond that immediate debriefing. I think those are very helpful. We have, what else here? Fitness for duty evaluations, I mentioned. Expert witness concerning police management. That's not anything I get into. That's almost a little bit more forensic. Coordination of mental health services at the detention center. Many agencies, ours as an example at the Broward Sheriff's Office, also are responsible for, and many sheriffs around the country, sheriff offices around the country are responsible for detention or correctional settings within their jurisdiction. In Broward County, we have detention deputies at the different jail facilities around the county. We've been working with them in terms of doing some behavioral health training. That's a particularly stressful line of work, as one can imagine, and historically they haven't gotten much attention. It's another area if somebody would like to do research in the field of law enforcement. Boy, there's a lot that can be done with the correctional officer population. There just isn't that much. Let's take a look at the next slide. All right, let's go to the next one. Next slide. All right, just a few things here I think that are important. Testing, interviewing of police candidates. I did mention that. That's part of the assessment process for those police psychologists who specialize in that. Teaching and training at the police academy or for different in-services. This is a big part of what police psychologists do and have to offer. When I got through the police academy for several years afterwards, I taught the domestic violence block at our academy. I also did some of the mental illness block. I know a lot of psychologists. Several of my students who've gone on to become police psychologists, almost all of them spend some time teaching at the police academy. That's not a full-time position for them, but that's part of what police psychologists do, especially when you have instruction in things like stress management, police stress. I think domestic violence is very relevant. There are a lot of different areas, I think, where psychologists have much to offer at the academy level. And I've always thought it's very important if you can teach some of these key issues and areas and discuss the problems up front that someone may have as a prevention strategy, you can offset a lot of problems later on. Now, of course, people at the academy level, whatever first responder group they're in, do not feel any of these problems will be theirs. They're young, they're excited about their career. This will be somebody else who will have the problem. So they'll sit there and listen, but they may not relate to these, but this needs to be reinforced throughout their careers. And what I always say to them when I'm teaching the young folks, the new police academy cadets, is, look, I know you feel that this won't apply to you right now, but I want you to know about this because in the very least you may help your partner or buddy later. Training supervisors and administrators is very important. And I give hostage negotiation units as an example. When necessary, let's say if you have a barricaded suicidal subject, it's usually up to the supervisor, namely the supervisor in law enforcement refers to the sergeant in charge of a particular shift. It's up to them, usually in most agencies, to call in a specialized unit like negotiators, like a SWAT team, when they feel a situation calls for it. But it helps to really teach and train them about these sorts of situations. Historically, supervisors have felt, well, road patrol can handle it. They can deal with these problems. We don't need to call out specialized units. When in fact, if you have the units, you better use them because they're trained to deal with these situations. And as a police psychologist, it's really very helpful to train those supervisors and administrators in the importance and the need for these sorts of things. Greg, let's go on then to next. All right, let's skip this. We're going to get into some of these later. Skip this one. All right. I'm going to just talk briefly, and I did mention critical incident stress debriefing earlier. So here's a critical incident. It's any event that has a stressful impact is sufficiently enough to overwhelm the usually effective coping skills of a person or group. All right, and these are outside the range of ordinary experiences. If the critical incident is extreme in nature, it may serve as a starting point for the psychiatric disorder called post-traumatic stress disorder that I mentioned earlier. Keep in mind that the threshold for a critical incident in a police officer is different than it is for a civilian. What civilians are used to, what police officers are used to is much different than what civilians are, and what a police officer would consider a particular difficult situation or critical incident. Their tolerance for these would be much higher than most civilians. And that's the unfortunate part. They're accustomed to critical incidents and traumas throughout their career. If they're not handled properly in terms of the response, these could lead to trouble later. Okay, Greg, the next. All right, so these are examples of critical incidents for emergency service people. Certainly a line of duty death, suicide. Let me skip down because number 4 really in South Florida in particular, where we are, is a big one. Any significant event involving children. We have a lot of child drownings in our area. We have lakes, we have swimming pools, we have canals, we have the ocean. So most police officers at some point in their career have to deal with these, and these really kind of take almost a top position in most of these types of considerations for looking at severity of stressors, especially if they have their own children. But all of these are critical incidents at some level, certainly line of duty death, the suicide, multi-casualty incident, disaster. We've been, all too many of them in our area in South Florida. We had the Parkland mass shooting back about a year ago. This Valentine's Day coming up will be 1 year. Part of my job with that was to help to provide critical incident debriefings and crisis counseling for police officers and to some extent firefighters who were involved in that event. Any kind of police shooting is always a critical incident. Excessive media interest may strike some as unusual, but it can be very stressful dealing with the media. And often the media can be very selective in terms of what they attend to with regard to law enforcement activities. Police officers will complain that usually they focus on negative things that happen to the exclusion of positive things. We know that's not exactly true, but there's, that's their perspective. Greg, the next one. All right, so I mentioned debriefing. Again, that's a group meeting following a critical incident, giving people the opportunity to talk, vent, form a cohesive group, and also to give feedback and do some psychoeducation after the event. And that's a particularly important role of the psychologist. When I have been involved in debriefings, a big part of my job has always been to provide some information and education about risk factors, what to look out for, in terms of their own mental health, both short as well as long term, and also to consider smart things, adaptive things to do, coping skills, coping techniques that work well, and what those might be and the importance of those, underscoring those, so again, to prevent problems later. Okay, and these debriefings really are a partnership between mental health people and trained peers. Mitchell, this is called the Mitchell model, although there are other models of debriefing. There's one called the NOVA model, which has nothing to do with our university, but it's another popular one. But the same idea, giving the people involved in critical incidents the opportunity to form a group, get together and discuss not the tactical aspects of an event, but their own personal reactions and their feelings since. Greg, next one. All right, so what we're doing with these, we're trying to decrease the impact, minimize, prevent problems from happening later, accelerate recovery as quickly as possible after a traumatic event occurs, facilitate return to previous level of functioning. All right, I'm going to jump ahead a little bit just to say that I always tell police administrators when they ask, well, what can we do to make sure that we keep our people mentally healthy? I always say there are 4 things to do, and one of them is to have people trained to do critical incident debriefings, diffusings, follow-up crisis counseling. You have to have that. That's really important. But that by itself is not enough. You also have to have, I think, peer support available, peer support teams that are available to help out, and again, to identify maybe high-risk people or people who are not responding well after critical incidents occur. And keep in mind that when we talk about post-traumatic stress disorder, the symptoms of a problem like that may not kick in right away. All right, they can be delayed. By definition, it is post-traumatic stress. It's after the event. Some cases you see the symptoms early after the event, sometimes days, weeks, months, even years. Okay, so again, you need those smoke detectors to people who are familiar with their colleagues, their coworkers, to know, because nobody knows best when somebody's having a difficult time within a law enforcement agency. People have been working together for years. They know what their buddy's baseline is, how they've been for quite some time. If they see a dramatic or a significant change in a bad direction, they should know that. So you have peer support, you have critical incident debriefings, CISM. We also have developed at NOVA a program we call behavioral health training. And this is a 2 to 3 hour prevention program where we present issues related to, I call them the big 5 or 6: anxiety, depression, substance abuse, sleep disorders, post-traumatic stress disorder, and suicide risk in law enforcement. I think that's 6 actually. But from a prevention standpoint, these are signs and symptoms of these problems. Be vigilant about these in yourself as well as coworkers. It's really, it is very much a prevention program, things to look out for. And again, I think that should start at the academy level and be reinforced on a regular basis throughout a police officer's career. Other thing that's necessary, you need to have resources in the community. And this is where the mental health counselor, the psychologist, the psychiatrist, you need a list of people and places to send those who are having significant problems that are beyond just a peer counselor assisting with some level of distress. If somebody really needs to be Baker acted or admitted to some facility on an inpatient basis for substance abuse or some other problem, you need to know where that person should go. Here in Broward County, our agencies have working on partnerships with some different hospitals that are willing to work with us that focus on veterans and first responders, and that's been very helpful and to give us confidence that if we have somebody who really needs more than an outpatient counselor or therapist, we know where they can go and they can go safely. Greg, the next. All right, so let me skip this, keep going. All right, this is where we get into the area of crisis or hostage negotiations. I always say I really have enjoyed working in this area because I think this is really a field where psychology has much to offer. All right, now most teams now will call themselves crisis response teams rather than hostage negotiation teams. And that's mainly to reflect the fact that most call-outs, and that's what they're called when there's a situation, it's a call-out, usually involve, in the majority of cases, barricaded suicidal persons. All right, usually, fortunately, do not involve hostages. Sometimes they do, but the majority are barricaded suicidal people having a significant mental health issue. Okay, so here, I like this quote: police officers are taught to take charge, to act quickly and with authority. The principles of hostage negotiation fly in the face of that training. A negotiator must fight the inner urge to act. Instead, he or she must sit back and use words to diffuse critical life and death situations. So what that means essentially is police officers are trained to be problem solvers. Get to a call, deal with that problem, fix the problem, get on to the next call. And they usually don't have a lot of time, especially if it's a busy shift. They may have calls waiting. They may have to be back up to somebody else. Their way of dealing with problems is to try to get them solved quickly and move on to the next problem. So when we're talking about crisis or hostage negotiations, it does fly in the face because the bottom line skill to have dealing with those types of situations is to be a good listener, to give that person in crisis the opportunity to vent, emote, talk, whatever you want to call it, but that's how you diffuse a crisis situation, and that takes some time and the willingness and ability to listen. So I mentioned I was doing CIT training earlier today, crisis intervention team training, which is nationwide now. That's part of the focus of that, to train police officers to sit and at least take some time to listen to people in trouble or in crisis, and to give them the opportunity to vent and to try to find alternatives where possible, and where there's a mental health issue, to get them the help they need rather than go to jail, which historically has been the case. Okay, and again, the key to crisis negotiation, crisis intervention is on the next slide, Greg. If you can put the next one up. Greg? Yeah, there we go. Active listening skills. When we're asking for new negotiators, we're trying to screen for new police hostage crisis negotiators, we ask them the question, what is the most important skill that a negotiator can have? If they say to be a good talker, we have a problem, because it's not about talking, it's about listening. Psychologists, mental health counselors, any mental health professional is very familiar with the active listening skills. These are used both for interviewing as well as building rapport, all right, with clients or patients. So we have emotional labeling, we have paraphrasing, reflecting, open-ended questions. This is sort of this is the bread and butter of crisis negotiations. And a lot of the training, or the time we spend training police officers in crisis and hostage negotiations, is to get them to learn to use these. Again, often not very easy in the beginning, because they want to rush to solve a problem quickly, and that does fly in the face of what we're trying to do. We're trying to build rapport, we're trying to build relationships, we're trying to diffuse a crisis. You don't get that by solving somebody's problem quickly, because they're not going to believe that you can do that anyway, and you lose the rapport. You have to take the time to listen. So that's what this is about. Greg, the next one. All right, and we usually divide, and this is something from some research I did with the FBI a few years back, when we're looking at trying to resolve crisis situations. The FBI has always had kind of distinction between expressive and instrumental situations. Expressive is that basically there's an emotional basis for the problem that's happening. That the guy is holding his wife hostage because she threatened to leave him, or she got into another relationship, and he's very upset, depressed, and angry. So there's an emotional basis to that. And in a sense, those are a little easier to deal with because you can get the person to then, if you're effective, you have the opportunity to get them to vent about that emotional distress that they're in. Instrumental, a good example of that would be a bank robbery gone bad. All right, they're in it for some, they're trying to get something. It's not necessarily emotional, and they're going to make demands. So it's goal directed, it's rational. It's not about something bad happening to them emotionally. Of course, they don't want to go to jail. They don't want to get caught, but they're gonna try to negotiate the best deal for them in terms of making some demands to get out of the situation. I would say probably 80% of what negotiators deal with are the expressive, emotional types. Interesting, I had a discussion with some European negotiators, and they're the opposite. They deal more with terrorists in those types of high-risk situations than we do here. Fortunately, at least for now, we have more domestically based types of problems, and they tend to have a more emotional character to them. Greg, the next. All right, we won't get into this. I know we're probably running out of time. I think we have maybe a couple of minutes left before I take some questions. But again, hostage, barricaded subject situations. The role of the psychologist in this is essentially to be the teacher, trainer, and the coach, to give suggestions and come up with strategies in dealing with these crisis situations. In most departments who have crisis negotiation units, who have psychologists attached to their agencies, will often use the psychologist in this capacity. And this is, again, a very operational one. The next slide. Okay, let's go on. Next one. Next one. Next one. Okay. This is sort of the process for negotiations. You use active listening skills. You demonstrate empathy, which is your ability to take the perspective of the other person. You use empathy, you establish rapport, and once you have those variables underway pretty well, then you can start to influence the situation to affect behavior change. The FBI and myself discussed this in an article that we published some years ago, and this, in fact, is called the behavioral change stairway. Of course, the situation can change, and the report goes bad, or something changes in the situation, and you kind of go back down the steps, but you keep really pressing these major areas. The next slide. Okay, I think, Greg, maybe this is a good place to stop and see if we have questions at this point. Would that work okay?
Yes, so we do have a question. This is from Lonnie. He said, when a person has tried several therapists and no one seems to understand or grasps that a person is spiraling, how would you treat and what direction would you send that person?
All right. My question would be, well, are we talking about a police officer specifically? Let's assume that we are, because we're talking about police psychology, and let's assume that's the case. Mm-hmm. And it's very difficult to find mental health experts who work effectively with police officers or firefighters. And it's simply because they have not gotten an understanding of the lines of work. And this has been a problem with employee assistance programs historically, where they just don't have the background. It doesn't mean you have to be a cop, you don't have to be a firefighter to work effectively with them, but you have to make efforts to learn about their job, whether it be ride-alongs, citizen police academies, or citizen fire academies. You have to make some effort to know that job. Don't have to do it, but you have to become familiar with it so you understand the language. Where that's not the case, that therapist probably is not going to work very well. I have a list of preferred providers that I just have. When I get a call from a police officer or a firefighter at this point who needs help, I'm not in private practice at this point, but I have several people out there who I trust, I know have worked well with first responders. You have to have some background and familiarity to work well with them. So again, I'm going to assume that maybe the question is related to people, a first responder who has sought help and has not been able to find someone who really they're comfortable with. Let me just give you one quick example I had recently. I had a police officer tell me, well, I went to see a therapist, and I told the therapist about this trauma that I went through, this horrific thing that happened, and he started crying. Well, that's not going to work very well, and I think not that these aren't difficult issues for therapists to listen to, but you need someone who can work well with a first responder. I don't know if hopefully that answers that, if in fact that question was about first responders.
We don't have any other question. However, I do have a question as we're going through these slides. Talk about that dual role that you have, professor and also law enforcement officer. Is that a balance that you have to maintain, or are you more a researcher one day and a law enforcement person the next day?
That's a good question, because all of the above, I guess. And as you mentioned in my intro, I've been involved in a good deal of research over the years with law enforcement, in the last few years also with firefighters. I have been operational as a member of our crisis response team and training coordinator for our team. I have done training. I continue to do training in crisis intervention and crisis negotiations. And tomorrow I'll be at the police academy doing some behavioral health training for a leadership group. So I guess I've tried to keep all plates spinning and have my, have my foot in everything. But I do tell my students, look, you don't have to be a police officer to do police psychology, because there are very few psychologists who really do have that dual role. But you have to make efforts to learn about the organization. I always tell my students, many cities, we have some in particular down in South Florida that are very good with what are called citizen police academies. These are usually 12 to 16 week meetings once a week, where different units within a police agency will do a presentation. At the end of the academy, when you graduate, you can also do a ride along. I think that's very important. I encourage my students to get certified in critical incident stress management and get the certification, going through a 2 or 3 day training program. So at least they have the training to be able to do debriefings and diffusing if they come up and if they're asked to, or if they're looking for jobs in a police agency. That's something that they can offer. The other thing that I have my students do is to volunteer as role players. We do a lot of hostage negotiation training. We have a monthly multi-agency meeting where we have different police hostage negotiation teams come from around South Florida. It's classroom instruction in the morning, and it's role-playing scenario-based training in the afternoon. Our students serve as role players in those situations, so they'll play the part of a hostage taker, hostage, victim, witness, whatever the situation calls for, and they assist because they're very good at the active listening skills through the coursework that they've had and the practicum experiences they've had with clients. They help to give feedback to the police negotiators as well. So again, you don't have to be a cop to work with them, but you better make an effort to learn about what they do and what the issues are, or it's not going to go very well.
We have 2 other questions from Thomas. Are NSU students involved in the behavioral health training program? If so, in what way?
Yes, that's a very good question. We have 2 forms of this. We have the behavioral health training for firefighters. We have behavioral health training for police officers, and they're very parallel in terms of the areas that we cover, but we really make them specifically geared toward each group. Anytime that I'm asked to do these, I always have students as co-presenters with me, because I see part of my job as a faculty to get students the experience that they need to have so that they're able to go out and do these sorts of things. So this morning, for example, I did crisis intervention team training. I had 2 of my doctoral students with me for that. They were co-presenters with me. I'm going to be doing training for our hostage negotiations multi-agency meeting tomorrow. We're doing behavioral health training. I'll have 2 other doctoral students with me for that. So any activity that I get asked to do with regard to training, I make every effort to bring students with me, not just to sit there, but to help to do training. If anybody's familiar with law enforcement, they can be they're an interesting audience. If they don't like you, if they think you're condescending, if you really don't know what you're talking about, or you know nothing about what they do, it can be hard to teach them. And I don't blame them. I've seen some very good academic people not do so well with that audience because they really, again, have not made the effort to learn about the audience. But our behavioral health trainings, we do many of them. Police and firefighters and students are my students who work with me, and I call it's the Police Psychology Research and Training Team. And this is myself and a couple other faculty who I collaborate with, but it's mainly students. The more opportunities they have, the better.
We have another question from Lonnie.
All right.
What have you experienced as the biggest transition for a military veteran into a police or FBI agent, especially those who have experienced combat?
Well, you know, and there is overlap. I mean, we have police officers certainly who were in military first and continue their military experience while they're police officers. I think the biggest issue is this. You know, again, it boils down to trauma exposure. You know, it depends on what they did in the military. You know, if somebody's really been exposed to a number of critical incidents and traumas, well, and you know, that could impact what comes up in this, you know, the psychological screening or psychological assessment. You can argue this a few ways. You know, if you have military experience, and certainly they're often preferred. Many agencies will give the military additional points or additional consideration, and I think that's very fair. That should be done that way. You know, when they want to become police officers, and one can make a good case that, well, they're already familiar with difficult situations and they've shown the ability to deal with trauma. Although, you know, cops in military are trauma collectors, right? They get exposed to an awful lot, and military will have, you know, if they've already been in combat situations and then they become police officers, boy, they've collected, or they're collecting quite a bit. And you know, the question will be, you know, how resilient is that individual? And most will be fine. You know, we say with post-traumatic stress disorder, for example, even when people are exposed to awful things, most 75% will generally be okay no matter what. We're always concerned about that 25% who might not be. And again, if you have someone from the military going, you know, looking to be a police officer, well, they'll still have to go through the psychological assessment that'll be looking at response to stress.
I do have a question. Big city or small town, does it really matter?
Yeah, you know, it's a very good question because this came up recently. I did a training for critical incident stress debriefers with a local police department just last week. And somebody asked just almost that same question. And we had a discussion about it because everybody assumes, well, you work in a big city, certainly the volume of calls will be greater and you know, the critical incident exposure will be greater. But then somebody who had previously worked at a more rural department said, well, that's true. However, when you're working in smaller departments, small towns and rural areas, you have two issues. One is you may not have backup if you need it or real soon, all right, because the staffing just isn't available. And the second thing is if something bad does happen to someone locally, you know them, all right? In many cases, you grew up with people. You know, everybody knows everybody. So if something, you know, tragic happens, it really has a significant impact. Whereas, you know, if you're in a big town, big city, you may not have a personal contact necessarily. You still be impacted by what happened, but it's not like you've known that person since you were a child, for example. So that was sort of the trade-off, and I thought it was an interesting discussion because the assumption has always been, well, if you work in the big city, that's much worse. You know, the officers from rural areas will say, well, that may not, you know, that's debatable. And it's a good empirical question, another good study for someone to look at, you know, a psychological adjustment given certain sizes of departments as a variable.
We have another question from Thomas. Are opportunities to be involved with police psychology, including crisis intervention and behavioral health training, open to general clinical psychology students, or are those courses part of the forensic track only?
Okay, good question. Again, I have a course that I teach every year, a police psychology seminar that up until recently wasn't even part of the forensic track. You know, some programs in forensic psychology will have police psychology, but I think the majority of them won't. I think what most students who have an interest in police psychology are going on to do that. Most programs don't have, they just don't. You know, it's hard enough to find a good forensic psychology program, and embedded with it, would there be police psychology? Probably the majority don't have them. The closest that students, or I guess, can do, aside from what we have at Nova, is probably to look at, you know, doing practicum placements and internships, maybe postdocs at the VA hospital, in the VA hospital system, because you get as close there dealing with the issues as you would in law enforcement. You know, primarily substance abuse, stress-related disorders, PTSD, you know, those sorts of things are, you know, kind of the big areas that the VA hospitals or VA outpatient clinics deal with. there just are not that many programs in police psychology around the country. You have to look for people who are doing the work. Good or bad, I think what I do at Nova is probably relatively rare. But I do get students who will come here in many cases just to work with me in this area.
Just one final question from me. What excites you about this area?
Well, a couple of things. One, I guess, is a personal one. I grew up in New York City at a time where crime was very high, and I learned a lasting respect for law enforcement just by virtue of seeing what they had to do back in that era. And still, I mean, it's changed, but it certainly was different when I was growing up. But in terms of what I do specifically, it's so varied. There are a lot of different things you do or can do. So it's not any one thing. As I said earlier, I could not sit and do testing all day. I could not sit and do therapy cases all day. I will spend part of tomorrow doing teaching and training for hostage negotiators, for leadership, for administrators. I'll come back here, supervise students. I'll consult with a couple of people on our research projects. So I think it's just the varied task and varied things that I have to do that keep it interesting. And again, without sitting in an office all day long.
Well, those are all the questions we have. We're now coming up to 6 p.m. And so I wanted to thank our presenter very much for actually giving this wonderful presentation. I know I learned a lot from it.
Thank you.
And his information is on the screen, so I am sure that he would welcome additional questions after this presentation. I do want to say that, again, this presentation has been recorded, and it will be uploaded to our website within the next week. So you'll have the opportunity of watching it again. So if there are no final thoughts, Professor?
No, if anybody has a question, I think you have my email contact information. Feel free to reach out, and be glad to talk to you, or email whatever questions you may have. Always glad to answer.
Wonderful. Well, thank you so much. Thank you, Thomas and Lonnie, for participating, and we look forward to seeing you sometime in the future.
Great. Thank you very much, Greg.
Alrighty. Have a good evening.
You too.